Our healthcare system is challenged with some of the biggest, most costly, and most pervasive problems we face as a community. While I don't have all the answers or the expertise or the time to go into those right now, I can talk a bit about how health technology fits into the equation. Specifically, I'd like to talk about how alternative ways of building health technology and businesses around that technology can have an impact in the world. When we think of healthcare, we tend to think of the clinical environment. These are the doctor's offices, the hospitals, the dentist's office, and so on. And while indeed this is where the majority of health spending occurs in our health system, there's a large and growing section of the healthcare industry that many overlook. That's community health. Community health is on the rise largely because of population growth and an aging population, among other things. But there's another demand on our healthcare system, specifically community health, that many don't know about. And that's that outside of the clinical environment is where the majority of problems actually exist. Only 20% of our health conditions are determined in the clinical environment. The other 80% is determined by a combination of genetics and socio-demographic factors. There's not a lot we can do about genetics, but there is a lot we can do about the socio-demographic factors. This is commonly referred to as social determinants of health. Social determinants of health are the conditions in which we grow, age, live, play, work. These are largely shaped by the distribution of wealth and power at a local, regional, and global scale. Having access to information about this kind of data is critical for us to better improve our healthcare system. But despite this need, tech and data is still out of reach for underserved communities like community health. This is largely due to a business problem. The large software vendors and data vendors in health tend to be closed. They're proprietary and they just simply don't play well with others. Additionally, they tend to focus on the clinical side, which shouldn't be a surprise because remember, that's where the majority of the spending occurs. No business model seems to fit to support these underserved communities. But still, access to data is critical. We need better access to data so we can understand how to better support field operations in health and how to better support the delivery of care to an individual. We need better technology to help bridge that gap. I'd like to share a little bit about a more recent opportunity that my team had. In Colorado, there are hundreds of community health providers struggling and trying to improve the collaboration within their network and the quality of care they deliver to their patients. These providers offer a diversity of services from delivery of Medicare and Medicaid to in-home food delivery. Each have different technology systems, different data formats, and different operational process to help our communities. We've been lucky enough to work with them to start to try to solve some of these problems around connecting providers within the community and providing better access to data so that people can better understand their patients and give them better care. As an example, a community clinician might enter a home of an elderly person to help them with food. But while there, they might notice that the power is out or there's mold on the wall. This provider needs an efficient way to refer this person to another community provider that can get rid of that mold or turn the power back on. Because at the end of the day, understanding the whole picture of a person's health is more important than just that one condition you're there to help with. Ultimately, this is a challenge of data, access to data, and access to the technology that helps deliver that data and make that data more meaningful. This is critical work. It's extremely critical. But it's also reactive. Community health providers need better access to information about the patient, the conditions they have lived, worked, and played in. so that they can better understand the conditions that might affect a person's health, so they can improve that delivery of care. Social determinants of health can help with that. Having better access to this type of information helps us better understand an illness that someone might be more susceptible to. Having access to this kind of information encourages a more proactive approach to healthcare, one where we're not necessarily just treating the symptoms, and we're trying to help the whole person. But still, scalable solutions to bring this data together are lacking. Closed systems hold us back. But I firmly believe that approaching business and technology from a more open perspective can help solve these problems. I believe that having more open strategies can help bridge the gap between technology and under-resourced communities. There are 3 pillars to an open strategy that I think are very approachable for many health tech companies, and maybe beyond that. That's open software, open data standards, and open collaboration. Open software refers to open source, or the process of giving your software away. It's a legal license you can apply to your software so as to enable the ability to analyze, modify, and redistribute that software without any fear of legal retribution. Open data standards refer to a common way to exchange data so that it's easier to share data amongst a network of machines or people who need access. An open collaboration simply means opening yourself up to collaborating closely with your customers, your partners, and the community in general. While this open approach to business and building technology isn't new, it is atypical. A more common approach to business is to build software behind walls. And there's nothing wrong with this. Many businesses are quite successful with this model, but it doesn't necessarily help you get closer to solving problems in under-resourced communities. Having an open strategy can help manage cost and stay focused on impact-driven opportunities. I suppose it's important to explain the managed cost aspect of that. By open sourcing software, you're able to work on that software over time and across customers, and across collaborators and partners. Oftentimes in software, you engage with someone to solve a problem. There's a fixed amount of time and a fixed budget, but eventually that budget and that time ends. Open sourcing your software allows you to work on these problems over time. So how do I know this will work? Quite simply, because we've been doing this for a long time, and we're not alone. We got our start helping epidemiologists plan for and track vector-borne disease overseas. Vector-borne disease, the most common one is malaria and dengue fever. The problems in this space are incredibly complex. You have mosquitoes, and believe it or not, there's over 4,000 species of mosquitoes, and only the females of a certain genus carry the malaria virus. To add to that, you have people on the ground in different villages, different towns, different types of structures. You have different distributions of water sources, which is where mosquitoes breed. You have different political influences, political boundaries, and different operational process to mitigate these diseases. So you have to have technology that helps you model data of things on the ground and things in the air, and how those things relate. Now at this point, people often will say, why don't you just kill all the mosquitoes? And probably most of us would love that. But we actually don't kill the mosquitoes at all. The goal is actually just to keep people away from the bad mosquitoes. So the way this is typically done is you would go to the inside of a structure, or house, or a hut, and you would spray insecticide on the inside of the walls. And that keeps those mosquitoes from having a place to land. So you simply don't give them a home, and they tend to leave people alone. A basic example of what disease transmission looks like, so one person might be in a village, might get bit by one of those nasty mosquitoes that carry the virus. They might walk to another village and get bit by another one of those mosquitoes. And that mosquito might bite another person in that other village. And just like that, you have disease spreading. So again, we need systems that can help us track things on the ground and change in movement of things on the ground and in the air. Ultimately, you just need to know where are the people, where are the mosquitoes, and where are the mitigation efforts happening. There's more to it than that, but I want to make it somewhat simple. Out of this problem, advanced open source software evolved. My team, over a long period of time, have been able to build a piece of open source software called GeoPrism. This helps us manage this type of complexity. I can't get into the details, but the basics are that you have data in all different formats all over the place. You have different spellings, different languages where the data is coming in from, different formats. You need to pull it all into one place and harmonize it, make sense of it. Enhance that data, maybe spatially enable it so you can make a map of it. That data comes from spreadsheets. It's not always so easy to make a map of. Additionally, once you get this data into the system, you need to pull it out so you can run reports, do analysis, make sure you're actually saving people. This kind of technology is hard to build. It took us many years. We rewrote this platform numerous times, and the only way it was possible is because we open sourced it. The greatest thing about it is as the software got more powerful, the costs remained the same, free. But tech alone can't solve the scale of these problems. Collaboration is absolutely key. I truly believe that giving this software away helped us build more meaningful collaboration with our customers, our partners, and the people who needed us most. This helped us bring partners together as well. Today, we're working with the Digital Solutions for Malaria Elimination Program. It's kind of a mouthful. We're a group of technical partners working to solve some of the bigger problems, more global problems around malaria elimination. So let's take a minute to break that down. Eliminate. Only Western countries that are less susceptible to this disease have actually eliminated malaria. Some quick facts. There's about 300 to 600 million people that suffer from malaria each year. About 500,000 die, and about 3,000 children die every day. So this is a serious problem still to this day. And these numbers have gone down over time. This is how I think of impact. How many lives can we improve or even save through our craft? To maximize impact, you have to empower others. I truly believe that open source software ensures maximum access to advanced technologies and solutions that help to empower others. This is true for international health, and it's true for local communities like community health. For us, being more open has enabled the ability to lower cost, deliver more value, foster better collaboration, build better software, and ultimately have more impact. So as we sit here in 2019 talking about all the ways in which we can have an impact in the world, I'd urge you all to think about how, now or in the future, you can work towards more open strategies to build technology or build business. Thank you.